Hi, and welcome to Something to Talk About. I'm Linda McNamee, and in recognition of February being Heart Health Awareness Month, we are going to be talking about heart health. But before we begin, I would like to thank everyone for tuning in this evening. If you would like to speak with our wonderful guest, whom you will meet momentarily, you could always give us a call this evening at 781-270-9199. Or if you want to email me with a suggestion for a future topic, or if you just forget something, you can always email me at talk@bcattv.org. And as always, I would like to thank the wonderful crew for this evening. They love, or maybe not so much love, giving up their Wednesday evenings to come and hang out at BCAT. So I would like to thank Chris Flaherty, a staff member here, making sure that the rest of us do not set the building on fire, which we haven't done yet. I would like to thank Colleen Moore, who is my wonderful director, and her wonderful assistants. I got to come up with a new word other than wonderful. We have Jolie Atwood and Stephanie Phloridis. Thank you, everyone, for coming this evening. And last but definitely not least, I would like to thank my husband, Paul, for staying home for Daddy Date Night, even though you are feeling a little under the weather. Hope you feel better. And now I would like to introduce my wonderful guest for this evening. We have Dr. Kandyce Mutter, who is a chiropractor in town, and also a lot more than that. Correct?
Yeah.
More than
I would like to think so.
You do kinesiology?
Yeah, so kinesiology.
Kinesiology. Okay, I looked at your website, and I just kind of like, that's a really big word.
Mm-hmm. Yes.
So.
Yeah.
Well, anyway, thank you for joining me for this evening.
Thank you for having me.
Before we begin our real discussion, can you tell me a little bit about yourself? Where you grew up, how you came to the Burlington area, and what made you decide to become a chiropractor?
Sure. So I'm originally from Fredericton, New Brunswick in Canada. So you might
You're
hear
Canadian.
I am Canadian. So I'm sure you'll pick it up in my accent. I try to hide it, but it's there. So yeah, I grew up in Fredericton, and I went to high school there, and I did my undergraduate studies there.
Okay.
And that's where the kinesiology part comes in,
Okay.
because I got my Bachelor of Science in kinesiology, which is basically like sports science.
Oh, okay.
Yeah.
It just sounds a lot fancier.
Yeah. It actually means the study of human movement. So it really lent
With the whole kinetic, okay.
Yeah, exactly. Yeah. So it was a really nice segue actually into chiropractic, because it complemented what I was going to be learning in my professional degree.
Cool.
Yeah.
Now, did you know as an undergraduate that was your goal, or did it just kind of, you graduated with your undergraduate degree, Bachelor of Science, and say, I think I want to do something else?
Actually, it's an interesting story. I was registered for physical therapy college in Halifax, so I was all set to go. But what ended up happening is I had an accumulation of a lot of old sporting injuries, because in high school I played rugby and field hockey. And
Nice, gentle sports.
Yes, I ended up injuring my back pretty badly, and it really got aggravated during my undergraduate degree with all the sitting in class and whatnot. So I ended up trying several things, seeing a physical therapist, and it wasn't getting better. And so here I was all set to go into physical therapy, but yet it wasn't really helping me with my own issues. So I was feeling kind of bad about that.
Yeah.
But then my stepmother said to me, you should go see my chiropractor. Yes, because at the time in Canada, chiropractic still was unknown. People weren't too sure about it. And my stepmother always went on a regular basis to help keep her spinal health good. So reluctantly, I went. I was really scared, but the chiropractor that I saw was wonderful. He explained spinal health to me. He took x-rays of my spine, and he showed me where there were subluxations in the spine.
Okay, that's a big word.
It is.
What does that mean?
It actually means a partial misalignment in the spine.
Okay.
Yes, that
I
creates...
wasn't sure if it was like a herniated disc type thing.
No.
Okay.
Thank goodness. No, it hadn't gotten that bad yet. So he showed me where the areas of misalignment were. And he said, what I'm going to do is adjust those areas very gently, and hopefully you'll feel better.
Wow.
And so
that's a lot of detail.
Yeah, definitely. It was great. So after one adjustment, and I tell this to everybody I can, I was literally 80% better.
Wow.
Yeah, it was really dramatic for me. And after that, a switch flipped. I had one of those aha moments.
Light bulb.
Where I was
Blink.
like, this is really crazy.
This is cool.
Yeah. And I knew from that moment that I wanted to share that with as many people as possible. I wanted people to experience that same feeling that I had. And thus the chiropractic
And
prodigal
here we
chiropractor
are.
was born. Yeah. And so I completely changed my plans. I had to actually tack on an additional year of postgraduate work before I could even go to chiropractic college.
Okay.
And then I went.
So did you still do the physical therapy route and then
No.
continue? Oh, okay.
Nope, I lost my $500 deposit. Yeah, in the grand scheme of things, it was a good decision.
But you're happier.
Oh, much, yeah, yeah. So then after that, I went to Palmer College of Chiropractic
Okay.
in 2003, and I did my professional training there, and that's in Davenport, Iowa.
Oh, okay. So how'd you make it out to Massachusetts?
Well, I got a referral from the chiropractor that gave me that first adjustment.
Okay.
And he recommended that I would do like a year residency with a chiropractor in Saugus, Massachusetts.
Oh,
And so literally the day after I got my diploma, I was on a plane. I actually left my family in Davenport. They weren't too happy with me about that. And I flew to Mass and I started working that Monday.
Wow.
Yeah, as his his associate.
Okay.
Yeah. And so I did that for a couple of years. I worked with him and one other doctor, Dr. Scott Fuller in Woburn, who I love to pieces. He's a wonderful chiropractor.
Excellent.
And then in 2010, I opened our practice with my husband,
Okay.
who is also a chiropractor. Yeah, and we've been in practice ever since. So we're coming up on our 8-year anniversary.
Wow. Congratulations. That's
Thank you.
awesome.
Yeah, yeah.
I got to cheat and look at my notes.
Yeah.
So everybody, when people think of chiropractor, they're like, okay, neck and back adjustments.
Yeah.
But looking at your website, there's so much more to that. I mean, can you tell me like some of the other maybe not so well-known issues that chiropractic care can help?
Sure. So we have people coming to see us for a variety of different things. The social understanding now in this day and age is that chiropractors help with those things, neck pain, back pain, sciatica, the list goes on. And I'm really thankful for that because it brings people to our doors.
Right.
But traditionally, back when chiropractic was first discovered, and back in 1895 actually.
Really?
Yeah.
I didn't realize I was that old.
Yeah. Well, right. It depends. It's all relative, right? Like if you look at Eastern medicine and, it's really, we feel in chiropractic that it's still a young profession because we have a lot of work to do in terms of research and different things. But anyway, back in those days, and when it was first discovered, the individual who performed the first chiropractic adjustment, his name was D.D. Palmer, he actually, he did it on his janitor. His name was Harvey Lillard, and Harvey was hard of hearing. And so he asked Dr. Palmer, he said, is there anything you can do? And so he checked his spine to see if there was any misalignments or anything out of order.
Yeah.
At the time, he really didn't know what he was looking for. And then he found a bone that was torqued out of place. And so he thought, okay, well, I'm just going to push on this bone. And what ended up happening after that is Harvey jumped up from the table and he grabbed his ear because his hearing had been restored.
Wow.
Right. And so that was the beginning of chiropractic. And so he developed this theorem that if the nervous system is in balance, if there's no interference on the nerves exiting out of the spine, then the body will function better.
So it's like a garden hose almost, nice garden hose. But if there's a kink in the garden hose, no water comes out. So
Exactly. Yeah.
okay. I know I'm oversimplifying this. So
No, you're not. No, and that's the garden hose theory. And that's a lot of times we'll explain it to patients that way. And what's really interesting is that if you fast forward about 20 years to 1918, when there was the flu pandemic, right? It took out something like 100,000 people worldwide.
Yeah.
Craziness. In those days in the Midwest, medical doctors were sending their patients to chiropractors because what they found clinically was that the individuals who were adjusted by the chiropractors, they had less of a death rate, 1/40th of the death toll of from the flu.
Wow.
So back in those days, the understanding, the social understanding of chiropractic care was that it helps to boost immunity.
Oh, okay.
Does that make sense to you?
Yes.
Yeah. Now, since the advent of antibiotics and, advancements in medical care, the tables have turned back to.
But does it really help, or was that just the perception?
No, that's what they documented. So
Okay.
there's a book. I forget the author right now, but the title is just Flu. And the author writes about this, how it happened in the Midwest, because chiropractic was still very new. But they were documenting all of these cases. So it's a really interesting thing to see how it's evolved, because the conversation about chiropractic has always been about health and wellness and better nervous flow, as opposed to back pain. So.
Yeah, a friend of mine, just within this past week was telling me that she's bringing her son, who's in elementary school, to a chiropractor. And ever since then, his attention's been better, his balance has been better. And, who would think that a 9-year-old would need to see a chiropractor?
Right, exactly. Because we all think, well, why is his spine hurting?
Yeah.
Right. And so that's where.
Why does your spine hurt if you didn't have an injury to it, too, sometime?
Right. Exactly. And so that warrants an explanation of the nervous system, right? So this is when I get my spine out.
Well, not yours,
yes.
but yeah, yours.
So I like to tell people that your nervous system is your master control system, okay? And up here is what?
Your brain.
Your brain, right? And I like to call it Houston Central, because it sends out signals.
Got it.
Right? And it does so by sending messages down through the spinal cord, which is like the information superhighway of the body, okay? And then out through 31 pairs of nerves. Now, these nerves...
Those are representation of the nerves.
Yes, they're not actual nerves.
Okay. Well, no, I'm just saying they're not like blood vessels or something.
No.
They're actually nerve representations. Okay.
Yeah, these little red guys there. Those
Red
are the
guys
blood
is,
vessels.
okay.
Yep. So these nerves go to every organ, muscle, and tissue that we have as human beings.
Okay.
And then there's other nerves that come back to the brain. And so we have this beautiful circuitry that keeps us running. Now, when we live our life, we learn how to walk, we have bumps and falls and sporting injuries and car accidents and all
Slipping
these things.
on ice, like we've been doing way too much lately.
Oh, no kidding. It's lots of people have been falling down here, and I've seen it in our practice. Lots of people with some back issues, right? Low back issues. So when these traumas happen to the spine, what can happen is a subluxation. There's the word again, right? Partial misalignment of the spine.
Oh, okay.
The problem with that, though, if left uncorrected, it can put a lot of pressure on the nerves.
Well, it would like pinch it, wouldn't it?
It can. What ends up happening is it ends up swelling like an injury.
Okay.
And the swelling is actually what can cause the issue with the nerve.
Okay.
Right? Now, sometimes the body can self-correct these things, okay? But oftentimes they don't. And this is where it becomes a problem with children, because if they are growing a lot with a subluxation in their spine, there can be some long-term damage or decrease in function of the nerve. Think of it as with a light bulb, okay? Right? And if there's a connection, like a fraying of the nerves, the light bulb might kind of flicker a little bit, all right?
Yeah.
And what chiropractors do is essentially we fix the connection so that it can be a clearer signal.
Got it.
Yeah. And so that's what your friend who's bringing, her son, right, to the chiropractor, he's going to check his nervous system out, and he's going to look for subluxations. He's going to find them, and he's going to correct them so that her son's nervous system can start working more optimally.
Okay.
Yeah.
Cool.
Yeah, right?
Who knew?
Who knew?
So I'm looking back at my notes because you were very good at like making this organized, and I'm totally messing up the organization. So we started talking about this, the history. I wasn't sure if you had anything to add to it about going beyond the basic back and neck pain. You talked about, is there really a connection, or was that just their knowledge base back in 1918 that it helped the immune system?
Like, is there a documented research connection?
Now.
Yeah. So,
has that been disproven, or?
No, it hasn't been disproven. And in fact, once we get into, talking more about heart health, I'll review some research studies that have shown that connection. And going back to the infancy of chiropractic, this is where we need to get more traction, is by doing more research so that the medical community can be more aware of these effects. There's lots and lots of case studies, tons of case studies. But when you look at statistics, a whole bunch of case studies have a lot of statistical power. Okay, and that's the
Or
era.
if you could get it to replicate.
Yes.
Yeah, okay.
And we, actually, my husband and I are a part of a board of chiropractors that are committed to compiling that research and just making it more accessible to the public. So that, and not only the public, but, you know, other healthcare professionals too, so they can have a better understanding.
Now, do you just make it accessible, or do you like connect the dots in the research?
Oh, it's yeah. Well, it's just a like a database. There's a lot of stuff on PubMed. You know, like you can research like the studies for heart. If you Google heart health and chiropractic, you'll get a whole smattering of the studies, or digestive health and chiropractic.
Digestive health too?
Yeah.
Wow.
Yeah.
Do you want to tell me more about that?
Sure.
Okay.
So
we'll get to health. We'll get to heart eventually.
Yeah, I know. It's a big topic. It really is. But all of these nerves through this part of the spine connect to the gastrointestinal system. Okay, and down lower, the genitourinary system. Okay, so if you have an issue up here, even up here at the top part of the spine, it can affect the functioning or the flow of nervous energy to those structures.
Okay.
So my credentials are DC. It stands for Doctor of Chiropractic.
Okay.
But in the profession, we call ourselves Doctor of Cause, because we want to unravel why something isn't functioning the way it should be.
Okay.
So we look to the spine.
Okay.
We look to the spine first to make sure these connections are optimal.
Because that's what's protecting the, you know, nervous superhighway of the spinal cord.
Yes. And this is why it's so important for children to get checked. You know, in the first 2 years of life, you know this as a mother, the amount a child grows is incredible. The spine doubles its size.
Wow.
So, and they're learning to walk. So what happens? They walk, bump, walk, bump, and then head gets hit, and it's like, it's craziness, right? They run into everything. But this is a really important time for a child to get checked, to make sure that everything's in alignment, and that so that they can grow optimally.
Okay. But their bones are still like rubbery at that point, so wouldn't it, you know, just kind of bounce back?
So great question. Yeah, no, I love these questions. These are great. No, and here's why. Because assessing a child is completely different than assessing adult.
Okay.
And that was something you were curious about in your questions. The technical approach is completely different.
Okay.
With an adult, we do exam, we do x-rays, we do a lot more detailed, you know, mechanical engineering analyses. With a child, it's very different. It's a lot of soft tissue assessments. We do a physical exam, but we don't do x-rays with a child.
Right.
We'll do x-rays maybe with, you know, an adolescent if there's been a trauma.
Right.
A car accident.
I was about to say like a concussion
or
for
something.
Sure. Yeah, so.
Yeah.
Okay.
So we really rely on, you know, our sense of touch, and we have different neurological checks that we can determine if there's a misalignment. And what I always love to tell parents, because they're always a little nervous about this, the pressure that I use to work on a child is the same amount of pressure I would use to check the ripeness of a tomato. So really, really gentle, because like you said, you know, the bones are softer and, you know, that's
There's
all
still
you
like
need.
more cartilage and stuff.
Yep.
Okay.
Yeah.
Now, one of the topics, you know, we're talking about digestive, and we talked about, you know, attention and ADHD. What about allergies, though? If somebody's allergic to something, what does that have to do with nerves?
Sure. A great question.
You know, especially like, you know, the peanut allergies that seem to be running rampant.
So there's different types of allergies.
Okay.
There's, you know, there's your seasonal allergies, which are crazy here in Massachusetts.
Yes, they are.
That was one shocking thing that I learned when I moved
Surprise! Here, have some ragweed.
Yeah, it's really crazy. So there's the seasonal ones, and then there's the food allergies, which are a little different mechanism. Okay. With seasonal allergies, this is where we found a lot of really great benefits. And in fact, this is how my husband got interested in chiropractic. When he was a child, he had severe allergies, severe
Like
seasonal
allergies.
Like just...
Now, would that be like also like being allergic to dust and molds and like
Yes.
dogs and cats and feathers and all that kind of stuff?
Yes.
Okay.
That mechanism, okay?
Okay.
Overactive immune system, irritants, environmental irritants.
Okay.
Okay? So his mother, my mother-in-law, brought him to our chiropractor. Actually, it was a chiropractor I ended up working for. That's how I met my husband. But
okay.
yes. Anyways, so she brought him to the chiropractor. And while his seasonal allergies really never went away. From that point on, the intensity, the severity of them was much, much less.
So he could still breathe. It just might be, itchy eyes.
Yeah, and he didn't have to live on Zyrtec, right?
Yeah, exactly.
And this is what happens with a lot of people. They can't go outside. They have to pound the Zyrtec and all kinds of this and that and the other to manage their symptoms so they can get on with their day.
Right, okay.
But what we find with people getting regular chiropractic care is that we ensure that the nervous system is lined up, it's functioning properly, and you got to remember the nervous system controls the immune system.
Oh.
That's the connection. When there's better nervous flow, the immune system can mobilize and do what it has to do to neutralize a lot of these environmental irritants.
Oh. Well, that's pretty cool.
Yes.
Tell me more. So, okay, we talked about, why. We talked about the treatment of children. How frequent or how common is it for kids to see a chiropractor? Is it still like in its, no pun intended, infancy stage? Or is it like more common practice? Or
it's
where
definitely,
does it fall now?
Yeah. So it's come back around really strong, especially in the last 20 years.
Until my friend told me that she brought her son there, it's like, really?
Yeah.
Okay.
Yeah. So we see a lot of families. So mom, dad, kids come in, get taken care of together. It's awesome. We love it.
Party! Yeah.
Party time. Yeah, it's great. We have a corner in our office where we have lots of toys and the kids kind of circulate it. It's awesome. So it's coming back around. We have a governing body called the ICPA, which stands for the International Chiropractic Pediatric Association.
Okay.
Of
so
which
it's specific to
chiropractic, yes. So it's a group of chiropractors who are committed to, working with children, also working with pregnant women, just to help optimize, spinal alignment, nervous function.
Now, is there special training that you have to go to be certified in pediatric chiropractic care?
Yes and no. Every single chiropractor learns how to adjust infants, children, adolescents in school.
So that's part of your basic training.
It is.
Basic training.
Yes.
Okay.
But the ICPA has an additional postgraduate program that you can take, which my husband and I both took, which also includes performing practice-based research, which we still have to do. So you do that out of your office and, submit studies. So again, talking about like bolstering our studying.
Okay.
And we're also certified in the Webster technique, which is a technique practiced most often in pregnancy to help balance the pelvis.
Right, okay.
So, yes, we do see a lot of children. We'd love to see more. We see lately a lot of infants actually.
Really?
Yes, with latching issues. And they're being referred directly to us from dentists and lactation consultants. Yeah.
Who would have thought?
Yeah. Well, a lot of times it's a biomechanical problem. If the jaw is offset, and if there's an issue with like tongue tie, which you may have heard of some.
I've heard about tongue tie.
Yeah. A lot of times that can interfere with how a child nurses. Or if the child can't rotate their head normally, then that can also interfere with how they nurse. Now again, remember, this is extremely gentle, precise care, and usually don't need a whole lot. They don't need to come like for years and years and years. I mean, it's small little corrections.
Yeah.
But huge, because if you can have a child turn their head more normally, they can nurse and eat massive results.
Right. Cool.
Important results. And that's what we want to get out there, is that message that there is options.
Neat.
Yeah.
Okay. Looking at my cheat sheet.
Yeah.
There was something that I read about, I think it was on your website, about chiropractic biophysics.
Yes.
What exactly is that?
So that is our specialty.
Okay.
Yes. So within chiropractic, there are a variety of different technical approaches. Okay. There's some chiropractors that will only use instruments. There are some chiropractors that only use their hands, and so on and so forth. There's a lot of, unique adaptations on how to work with the spine.
Okay.
So my husband and I are
So
trained.
that's like your individual choice, or is it like a style, or is
Yeah.
it? Okay.
Yes and yes. So when we are in school, we learn a variety of different techniques.
Okay.
And usually what ends up happening with chiropractors is they zero in on one technical approach.
Okay.
And that's how they assess and adjust people
Okay.
moving forward. So it's the most researched technique in chiropractic. And that was
Okay.
another really appealing thing for
Okay.
me because I love science. And it's also based on mechanical engineering.
Okay.
So what we do X-ray analysis, and we put an overlay of an ideal spinal model to see how people measure up. And this
Wow.
is one of the
Okay.
things that has been studied in
Okay.
chiropractic, is what does a healthy person's spine look like?
Yeah.
And the founder of the technique, his name is Don Harrison.
Okay.
And back in the 80s when he came up with this, and this guy was a chiropractor, but also had a PhD in mathematics and mechanical
Ooh,
engineering.
Okay.
So super
So
smart.
there's the connection.
There's a connection. And so he was interested in how he could apply mechanical engineering to the spine. So what he did is he studied thousands and thousands and thousands of spines and also health histories to correlate health. And what he found is that there is an ideal alignment of the human spine that correlates to optimal health.
Oh.
And so that's the basis of our technique. And it
Okay.
involves the curves of the spine. It involves optimal, postural alignment. So it's a very global view of what your spine looks
holistic
like. Oh,
kind
yeah.
of- Okay.
Yeah.
And hence the tie-in with all the other systems,
Yes.
like the. Okay.
Yeah.
So can we start talking about the heart health part?
Yeah, absolutely.
Because it's like, it blew my mind. It's like chiropractic and heart health. How are they connected?
Sure. Yeah. So you can't
Or
really...
should I just start reading the questions?
Oh, yeah, no. I mean, I'll just go if you want. Yeah.
Just go for it, because I know nothing when it comes to this. I'm like, okay, this sounds kind of cool.
So, where's our chart?
Oh.
I want you to look at it while I'm explaining
Okay.
it, so you'll have an
I have it
idea.
somewhere, and I think Colleen has it on a still store.
Yeah.
If she can hold that up.
So you can't really
there we
talk
go.
about heart health and
Okay.
chiropractic without talking about one of the divisions of the nervous system.
Okay.
And that's the autonomic division, okay?
Okay.
Now, autonomic, I want you to think automatic. Okay?
Yeah,
These
like
are
breathing and
bet.
heart rate and
yeah,
okay.
digestion, immunity, repair, all of these things happen for us
Okay.
without you having to consciously think about it.
Okay.
Okay? So within the autonomic nervous system, we have two divisions.
Okay.
You have sympathetic, and then you
Okay.
also have parasympathetic. Now, the way I explain these systems, sympathetic, it's like pushing on the gas, or it's our fight or flight. You may have heard
Okay.
of the stress response, right?
Yes.
It's our primal response that keeps us out of danger.
Okay.
Okay? The parasympathetic system, that's more like the rest and digest and repair system. Okay?
Oh, okay.
Now, the other way to think about this, I like
So
to
like more like an active versus a passive?
sort of, yeah, yeah,
okay.
for sure. When one is active, the other one is usually more dormant.
Okay.
So if you think of like the muscles in the arm,
Okay.
if I flex my hand this way, these muscles flex and these ones relax. Okay. So if
okay.
your sympathetic or your stress response is going, okay, what's going to happen is your metabolism's going to increase. Your pupils are going to dilate because you want to take in more information.
Okay.
Your blood is going to be diverted to the periphery so that you can run away from the proverbial saber-toothed tiger, or run to the bus.
Okay.
That sort of thing. Now, conversely, if you flip over to the parasympathetic side,
Okay.
right, this side contracts, this relaxes,
Okay.
okay? This is when, we're at rest. We're sitting at home watching the tube. Our food's digesting nicely, okay? At night when we sleep, our body's laying down scar tissue, repairing the heart, okay? All of these things are happening.
Okay.
Now, what I want you to remember is the location of these different sections of the nervous system, okay?
Okay.
The sympathetic or the fight or flight section is located right in here, okay? The thoracic spine.
Okay. So kind of like the central zone?
Yes.
Okay.
But the parasympathetic, the rest and digest and repair, is located up here. Remember that, way up here in the top, okay, under the skull.
Right next to your brain.
Yes, and also down here,
Okay.
okay? Now here's the connection. There was a study that was published in the Journal of Human Hypertension, And what they found was that when people who had high blood pressure were adjusted in this part of the spine, which is the C1 vertebra, or the first vertebra in the body, they also call it atlas. When they were adjusted, they had, I think on average, a 17-point drop.
Wow.
In blood pressure.
That's like huge.
It's massive. In fact, the medical doctor who did the study, he said that that result is better than using the 2 leading brands of blood pressure medication combined.
Combined?
Combined.
Wow.
Because a lot of times people will take multiple blood pressure medications, right, to achieve the desired effect.
Okay.
So, yeah, it was a crazy study. And it was because they were getting this bone adjusted. And here's why. Because within there, like you said, this deep within the brain, right? This is where the blood pressure control centers are. And if you are subluxated in that part of your spine, it can interfere with the functioning of that area.
Wow, okay.
So if you can release that subluxation, make it function better, the body will naturally bring it down. Isn't that cool?
That is cool.
Yeah. And that's
chiropractors can do that?
Absolutely. Absolutely. I mean, I wouldn't say that all chiropractors do that. So if this is something that you want to check out, you know, and you've talked to your medical doctor about it and you want to do conservative management.
Because I know people that are like on blood pressure medicine and it's still not working. And so instead of adding on the second or raising the dose, just wondering if something like that could be an option.
It's worth a trial. It's worth a trial. And what's really great is we're actually getting cardiologists that are sending people our way. And that's why I brought this book.
Okay.
All right.
But I'm so rudely
No, that's okay. So this was written by a cardiologist. His name is Jack Wolfson. He happens to be married to a chiropractor, though. So he has a nice understanding of the nervous system. And he has a whole chapter in there on chiropractic and what I just explained to you, okay, the different divisions of the autonomic nervous system. And he said the first thing I do when I have a patient that has a slight rise in blood pressure, I send them right to the chiropractor, his wife, down the hall. Go get adjusted.
How convenient.
Yes. Yeah. So they go and they go through a course of care, right, to see if it helps.
Now, is this like a regular adjustment, like a monthly, weekly, monthly, or?
Well, it would depend on the shape of the spine, because you know, if someone had a lot of wear and tear in that part of the spine, if there was like bone spurs and degeneration, it might take a little longer to like get the segment moving normally again. But if it's, you know, a regular, you know, a healthy otherwise individual, it might not take that long. So, yeah.
Because I'm just wondering how, well, you kind of answered this, but I'm just like, once you as a doctor put it back, what are the chances of it slipping out again like it used to be? Or either like either for memory? No, like
muscle memory.
Muscle memory. Thank you.
No, that's a great question, and that's actually where my technique comes in. So chiropractic biophysics.
Okay.
So we adjust the spine, but then we take that global view of everything and we apply other therapies to help support that correction. So we do things in our office like traction. Okay. It sounds kind of scary, but all it is. Yeah.
Like the rack.
Yes. Right. Exactly. It was funny, actually, the doctors back in those medieval days, they looked at that and they saw the therapeutic value. Much less, though.
Yeah. Do you believe that? I got a lovely bridge to sell ya.
Yeah.
Okay.
So the traction, it's very gentle. You know, you essentially put the spine into a corrected position and you just stretch it. Okay. And over time, it's just force over time, the body will remodel itself. Okay. And then that position will become more permanent. Okay. But it takes upkeep. It's just like, you know, going to the gym, keeping your dental health well. You got to brush your teeth every day. You got to go consistently to the gym. You got to get your adjustments, and you also have to follow your home care. And those are things that we give to people.
What kind of home care would you need for something? Is it like an exercise program? Is it, you know, food related? What?
It depends on the person.
Depends on the person. Okay.
And first, what they want. Okay, because we might have our agenda of what we think they want, but then if they come in and
no.
You know, we want the works for everybody, but we always meet people where they're at, right? If someone is just looking for a little bit of pain relief, we meet them where they're at, we tell them the chiropractic story, and then we go from there. What tends to happen is that once people feel better, they want to know more and they want to do more. Okay. So just to give you a few things though, we always have like a spinal stretching program, basic like easy stretches that every human being should do every single day of their life.
Okay.
It's so important to maintain the motion in your spine. One of the best things that I read and I tell patients is that 90% of the nervous nutritive input to our brain comes from our spine. And the reason is because there's so many little joints. And so every time you move a joint, your brain gets fed a signal, okay?
Right, okay.
Right? And that's why exercise is so important, and moving your body in all kinds of different motions is so important. It feeds the brain.
Okay.
Right? So keeping your spine moving in a healthy way feeds your brain. So, and that's a big thing, 90%, right?
Yeah, it's huge.
It's huge, right? So we always want people to do spinal stretches, which feed the brain, get their adjustments regularly, feed the brain, strengthening programs too. So we have a functional trainer that works with us as well. So she'll assess where people are weak, and we go right for that. Because like you said, muscle memory, right?
Yeah.
You have to address the musculoskeletal system. The whole thing works together. So there's a lot to do. You know, it's a lot of steps to move people through, but we get them through.
Now, one thing that you had mentioned, you know, meeting the person where they're at, what do you need to tell this person? What if they wanted everything done at once? I mean, is that possible? Is that recommended? You know, because I keep thinking back to when I had braces. It's like, okay, I wanted my teeth to be, you know, straight overnight.
Yes.
But that's not possible. You need the smaller changes. So
Yes.
with chiropractic care, in your experience, is there like a protocol where you have to like fix this first and then fix this, or just, you know, small baby steps?
Yeah, there usually is, but it depends on the age category.
Okay.
It depends on the health of the person, right? So if you have like a 20-something or a 30-something who's, you know,
goes to the gym all the time.
goes to the gym and eats well, you're going to be able to add a whole lot more to their program than say someone who is maybe a little bit older, doesn't really take care of themselves, you know, isn't really compliant. Like it just, but ideally you kind of get them to that space where they have, you know, optimal health. Like I said, we have our agenda. But
it might be somewhat hidden sometimes.
Yeah, it's we want optimal health for all of our patients, you know, and we'll take them there if they want. We'll go through nutrition too.
Okay.
I educate a lot about that, like the foods that really nourish the body and help healing, and nourish the heart and whatnot. And we talk about supplementation, and we talk about, you know, proper movement for the body.
Okay.
Right? You know, you had asked about exercise. You know, not all exercise is super healthy for the spine.
That's true.
Right? I mean, if you're doing a whole lot of like big heavy deadlifting, that might not be right for you, especially if you're misaligned in the spine.
Because you're just aggravating what's already misplaced.
Exactly.
Okay. So we talked about blood pressure up at C1.
Yes.
What else? You mentioned the top of the spine and the bottom of the spine. I mean, you know, the whole heart health thing. There's more than just blood pressure. There's everything.
Yeah. So when I talk to people about blood pressure, coming at it from a wellness standpoint, you know, a lot of times if you go to your doc and, you know, you have high blood pressure, they might just write you a script for a high blood pressure medication, depending on the medical doctor. You know, my hope is that they would take the time to talk to you a little bit more about your lifestyle, but a lot of times they don't have that time. You know, they have 6 more people in the waiting room, right? I'm so happy that that's not my situation. I can talk to people about that stuff. So,
and some doctors, don't mean to interrupt, but some doctors also recognize there's a connection with the kidneys.
Yes.
As well.
Exactly. So the kidneys talk to an area in the brain called the hypothalamus.
Okay.
And think of the hypothalamus like a conductor. It conducts nervous messages to the body, and it also conducts hormonal messages to the body. All right. Now, when the hypothalamus detects that the blood is thick and viscous, and a lot of times that will happen when your blood pressure is up, right? Because the blood doesn't have enough water in it. It'll tell the kidneys to release something called ADH, which is antidiuretic hormone. You may have heard of it before. You don't have to remember that.
Good, because
Right.
I probably will.
So what that does is it actually forces the body to put water
Into your bloodstream.
Exactly, to thin it
To
out.
thin out the blood. Okay.
In an effort to try to reduce the blood pressure. Okay? Now,
Okay.
here's the problem. This is a symptom of us as a population being so dehydrated. Okay, this is an easy remedy if people just drank more water.
Okay.
But we are chronically dehydrated. It's crazy how dehydrated we are, right? There's
Actually, the guest on my last show, she said, just to get your body to work optimally. Oh man, I forgot what it was already. The formula. Half your weight in
Yes.
ounces.
at least.
And I'm like, holy cow.
That's a lot. I know.
That's just to maintain. She says
Yeah.
for optimal, you need more than that.
Exactly. So
Wow.
imagine a
Okay.
person, right? So they could be getting a blood pressure medication when they're actually dehydrated.
Okay.
And that could be the solution. The other thing
But that
is,
won't fix the dehydration. That just kind of
No.
puts a Band-Aid on a broken arm.
Exactly. So
Okay.
that's why I like to explain that connection to people. The other thing is an accurate assessment of stress, because stress is a real thing. So many people are walking around chronically stressed out.
Yes,
So
that's true.
yeah, like if you
You
think,
can't, sometimes you just can't get rid of the stress either. So what do you do about it?
yeah,
What can you do about it?
about stress.
About stress or about treating how, just finish.
Yeah.
Just shut me up.
That's okay. So, so that I think that is something that our primary care physicians need to talk to us about.
Okay.
And if they can at that moment, maybe send them an email and just discuss this more, because it's very real. Okay, I feel that stress management should be first and foremost before anything else being addressed, before nutrition, before exercise, before sleep, even before that. Because if you're chronically stressed out, you're certainly not going to feel like making the salad, let alone eat the salad, because everything in your
It's a lot easier just to pick up the phone and
call Domino's. Totally, right? Great minds. I love that. But it's so true, right? It's so, and everything about your evolutionary biology is driving you towards the foods that are going to satiate the pleasure centers in your brain. The salty, the sweet, the crunchy,
Chocolate.
carbs, right? Exactly. You're not going to want to go to the gym because you're probably not sleeping well, because your nervous system is so irritated. You might, wake up during the night. You might not get enough sleep. So that's why I think stress needs to be.
And when you get the munchies, carrots just don't work.
Absolutely not. And so that's why I think stress is a very real problem.
Okay.
And it's actually the number one cause of heart attacks in this country, is too much stress.
Okay.
Yeah. So it's a very real thing.
Yeah.
Yeah. So in terms of stress modification,
Okay.
if you remember anything, it's these two things. And I actually just spoke at the library last week, and I told them the same thing.
Okay.
You have to move your body
Okay.
somehow regularly. You have to. And then you have to pick up either a meditation practice or a prayer practice or some sort of daily practice where you can just
relax, decompress.
Yeah. And it's not scrolling Facebook, because that activates the dopamine in your brain. Do you see what I mean?
Screen time. Let's play video games,
Yeah. And those are the two things that have been shown to help modulate stress. That has been the most effective. I mean, there's lots of things you can do.
Now, as far as like movement and exercise, is this like go running, or can you just like take a walk around the neighborhood? I mean, does it have to be a certain level of exercise or just movement in general? Does that make sense?
It does. It
Okay.
does. I think it needs to be just some sort of movement, regular movement. Okay, not like I'm going to go to the gym once a month. That's not going to do it for you.
It won't.
Yeah. So regular movement. We as human beings, we've really de-evolved, right, with our workstations and our technology, right, and we are largely sedentary. And unfortunately, our bodies are starting to change as a result of this. It's something called Wolff's Law, and it says that the human body will remodel itself according to the stresses you put on it. So we really need more motion.
Darwin was right. Yeah. Okay.
Survival of the fittest.
Survival of the fittest.
Yeah, exactly.
Okay.
So if you want to survive, you need to start moving better, moving more. And it doesn't have to be like a marathon. You just have to, like, parking far away from the grocery store, like old concepts like that. Like, people really need to do that stuff. Taking the stairs.
Don't use the drive-through.
For sure.
Unless you
Walk
have
to Domino's.
Walk to
Walk
Domino's.
back with your
Yeah.
pizza.
Yeah, now they have, oh, sorry. Like, now they have pizza delivery guarantee or something if something happens to your, anyway, I don't want to turn into a commercial.
Yeah.
So, okay, what other, okay, de-stress,
Yep.
leading cause, or stress is the leading cause of heart issues.
Yes.
What else can we do about heart health and how it might be related to other other systems?
Yeah. So I always like to talk about sleep with people.
Okay.
In terms of like a hit list of things to do.
Okay.
Yeah, sleep is one of the things that I lecture on a lot. And it's been found that people that are sleep deprived have higher incidence of heart issues. And the reason why is because when we go into our sleep cycles, okay, you've heard of REM, right?
Yeah.
Rapid eye movement, and there's a slow wave sleep. There's a specific time where the heart repairs itself. Okay. And what has to happen is we have to be in a deep enough sleep that our heart rate drops down. It's like pulling the car off the freeway, and the body can, clear out the arteries, repair any tears, etc. Okay. Now, if I've lectured to first responders before, and this is a huge topic for them because they have higher rates of cancer and higher rates of heart disease because their body doesn't have the opportunity to heal, because they're coming out of sleep to go to a call, right? Or their sleep's all disturbed.
They also have, depending on where they are EMTs, some have really flaky shifts.
Yeah. Yeah, and then it'll switch
like
over.
your morning and then your night, and then you're back to morning and night. And so
Yeah.
your body can't develop a pattern because it changes every 2 days.
It's crazy. It's crazy the amount of damage on shift workers. In fact, being a shift worker is classified as a 2A carcinogen.
Really?
Yeah, alongside like ether. And it's horrible.
Okay.
You can look this stuff up online. It's madness because of the effect on the circadian rhythm.
Okay.
Right?
Yeah, that's what I was thinking of.
Yeah,
Okay.
that's it. It's totally against our biology to be a shift worker.
Okay.
Yeah. So sleep is really important, dialing that in.
Okay. Now, speaking of sleep, as you're talking about it, how is apnea connected? Is apnea connected to everything else? Because I know I have one of those handy little machines at home
Yeah,
to
absolutely.
keep me from snoring.
Yep. So there's a couple of different types of apnea, right?
Okay.
There's a more rare, like a sensory apnea, which is very severe. But most people, when they think of sleep apnea, they think of obstructive sleep apnea, right? Where there's a relaxation of the throat and it creates an obstruction, a physical obstruction. It's very serious. And the problem with sleep apnea, it's highly underdiagnosed. I can tell you, I would say 1 out of every 20 patients that comes along my table has undiagnosed sleep apnea. And I can tell because if they come to me, say, and they have a complaint of neck pain, if they're taking a really long time to get through it, then first thing I'm asking is how they're sleeping, because they're not healing in a typical fashion. So this is where the tie-in comes in.
Okay.
And so with sleep apnea, I make sure that first they need to go for a sleep study, right? Which is essential. You don't want to mess around with this stuff, right? You want to get diagnosed. And while a CPAP machine, it's not a perfect solution because it can create other issues with the spine. And it's, it's kind of it's a mess sometimes. I think they're getting better with their designs, but there's other things that can help support sleep, things like essential oils, things like managing your technology, creating a sharp cutoff an hour and a half before you go to bed, managing your environment, complete darkness. I could go on and on, but I won't.
So what other health issues? We talked about high blood pressure. What about like strokes? Because that's kind of related to health. Well, are they?
Well, sure. Like strokes, that has a lot to do with like the density of the blood.
Yeah.
Yeah, the patency of the arteries, right?
Right.
So it's the same sort of thing. You want to, from our perspective, we're going to really work hard on managing the lifestyle factors, right? So we're going to look into diet. We're going to look into, all the things I was talking about.
Okay, we talked about, we had mentioned cholesterol. How does that play a role? Everybody's talking about lower your cholesterol, eat Cheerios, or whatever.
Yeah. So this is a very unconventional view, but the problem isn't dietary cholesterol, although it has been vilified over the years. Okay. We've heard don't eat eggs and watch out for lobster and all those high cholesterol foods that most people really love. We've been told to avoid them. And even
it's usually the lobster marinated and swimming in the butter that is usually the problem.
Yes, right. But here's what I need to tell people. And actually, I think I read about 40 million people that take a statin, which is a cholesterol lowering drug. And it's a part of this whole thing, right? But the research shows that only 50% of people that have heart disease actually have high cholesterol. So
that doesn't seem to be a strong connection.
No, logic.
It doesn't seem significant.
Right. It's illogical to say that, well, cholesterol causes heart disease. So here's what I like to tell people about cholesterol. Now, another thing is that in my clinical practice, I have noticed an increase in something called low testosterone. I don't know if you've ever heard of it. There's like commercials about it now. The drug companies are starting to make.
Drug companies are doing a lot of things that I'm just like tuning out.
Sure.
Because sometimes, the little disclaimer at the end seems so much worse. The side effects seem so much worse than what the medicine's trying to treat.
Well, this is it. And with statin drugs, there's one of the side effects is kidney failure, liver toxicity, and also muscle wasting. So it's very real. All right.
Yeah.
If you go to your doctor,
it's like, do I really want to take this? If all these other things can happen to me.
Right, and that's what you have to ask yourself. But with low testosterone, we've seen this rise in it, and it's because there's been a concurrent rise in statins. Here's the thing. Cholesterol is the seed of all of our hormones. Okay, it's a very necessary substance in our body. And the majority of our cholesterol actually gets made in our liver. Okay, our body makes it on purpose because it's the base of our hormones.
And we're trying to get rid of it.
And we're trying to get rid of it.
Perfect sense.
Yeah.
Not.
And testosterone, I mean, that's a hormone that makes a man a man. It's a very important hormone. Just like estrogen is the hormone that makes women a woman. A woman a woman. Yeah. So here's the issue, and here's the thing that people need to know. Only 90% of our cholesterol actually comes from our liver. Like if we look inside you right now, 90% of your cholesterol was made in your liver.
Really?
Only 10% of it comes from our diet. Yes. So yeah, and most people think, oh well, if I eat that lobster, that's gonna So what I do want to talk about now is carbohydrate, and this is what people aren't talking about, and what happens. So when we eat carbohydrate in the manner that we've been told with the food pyramid, right? It's the bottom section. Eat, now granted, there's fruits and vegetables down there too, which are awesome, but there's also, grains, pastas, other things, and the list goes on
Everything my son eats.
Yes.
And only stuff that my son eats.
Yeah.
Okay.
So we're taught that. We're taught to eat, 5 to 10 servings of carbohydrates, grains, whatever. Well, what happens in the body when we have a carbohydrate-laden meal, our body takes it in and uses it for whatever, and then it stores the extra, It stores it in 2 different places, muscles and also liver. First, it fills up the muscle storage.
That's why all the marathon runners have a big pasta dinner right before they run a marathon.
Yeah, because they want to fill up their stores so they have maximum power, But what happens when you have a surplus? All your stores are filled. It doesn't go back into circulation. Your body's smart, because if you did that, the blood would turn into like syrup, and it would kill you.
Yeah.
So
that wouldn't be my first option now.
Right. So what the body does, in its infinite wisdom, is it will convert it into something called palmitic acid. And then what
that doesn't sound good.
Well, just wait, it gets worse. So palmitic
it converts
acid.
It to acid.
Yeah.
Okay.
It adds a couple other protein molecules and hooks a little bit of cholesterol in it. And what you have then is something called VLDL. Have you ever heard of that before?
I don't believe so.
It stands for very low density lipoprotein. We've all heard of LDL and HDL, right?
Okay, yes.
HDL is your good cholesterol.
Yes.
Right? LDL is your bad cholesterol. Okay. VLDL, very low density lipoprotein, is your very, very bad carrier molecule of cholesterol.
Of course. Okay.
So that's what happens. You don't want a whole lot of that in your body.
Okay. So we can eat less carbs?
Yes, that's the lesson. The lesson is in that.
How do you know if you have too many of those?
Too many carbohydrates?
Or too many of those very low density ones?
So you would probably want to go have a lipid panel done. Like you could go and have a blood test and they would measure. And that's what most people do to check on their heart health. They'll check their levels of HDL, which is the it's called the good cholesterol. But we want lots of those guys, okay? Lots of high density lipoproteins. All it means is that it's a heavy molecule and it can course its way through the cardiovascular system without getting hung up on anything.
Okay.
Low
like
density.
The little bulldozers going through.
Yeah, I like to think of them like, F-150s. They're like big trucks just pounding through, right? And your cardiovascular system's kind of like a super highway, right?
Okay.
Now, low density lipoproteins, they're lighter. They're kind of like your compact car. Beep, beep, kind of going around, but it'll get hung up sometimes if there's any damage on an arterial wall. It'll get stuck there. These are the types of things that create blockages in arteries, or traffic jams. Like a lot of LDLs will get stuck together and create issues. VLDL, it's like a tricycle going along.
On the superhighway.
On the superhighway of the cardiovascular system. You don't want a lot of these things. So that's why I like to teach people is you have to watch your carbohydrate intake. And that's one of my steps to managing heart health is, yes, be aware of the cholesterol you eat for sure, because there, in some instances, cholesterol can contribute. Okay. It's not causative of heart disease, though, not by a long shot. But be really conscious of the choices you make for your carbohydrates. So I tell people about the glycemic index.
Yes.
And learn the glycemic index. You've heard of it?
I've heard of it.
Yeah. So like way up on the top is like white bread, right?
Yeah.
Yes, white bread. And that's because
there's no nutritional value whatsoever.
Sure, and it turns into sugar in an instant. All right. There's not a whole lot of digestive processes to break it down. Okay. If you actually look on
that's why everybody's encouraging like the whole grains, because it makes your body work harder, right?
Yeah, yeah, certainly. I mean, sprouted grains are an even better option, okay? But yeah, that's what you want to do, is eat those carbohydrates, complex carbohydrates that are more nutritionally dense, as opposed to like the simple carbs. Like even too much fruit can run you into problems as well. There's some people out there that only eat fruit, but at the end of the day, the body sees it the same way.
Probably better than eating a Twinkie, but...
Definitely.
Okay, but you know what? I hate to do this to you, but we are out of time.
Wow. That was fast.
And we still, you could talk so much. I could learn so much more from you.
Oh, thank you.
But I do want to thank you for coming in and meeting with me and speaking with me and teaching me a lot about what's going on inside and how everything's related.
You're welcome.
And I want to thank everyone at home for tuning in this evening. I hope you learned a lot like I did, and I look forward to seeing you around town. Okay, good night.